Thank you so much, everyone, for tuning into our conversation with Helen Clark. Now, we're going to be doing a deep dive on some of these recommendations by the independent panel. And we have our panelists today coming from different perspectives, and I'm really excited to hear what their take on some of these recommendations and how we can, take them forward. So I'm just going to introduce them briefly to you. We have with us Gabrielle Fitzgerald, co-founder of the Pandemic Action Network. We also have with us Chandrika Bahadur, director of the SDG Academy. And we have with us Dr. Ambrose Talisuna, regional advisor on the IHR and global health security at the WHO Africa office. Panelists, thank you for joining us today and welcome. You've heard, Helen Clark talking about some of the recommendations. Now, I want to hear your take on this. Just very briefly, can you just tell me one or two things that really caught your attention among the recommendations of the independent panel? Maybe we can start with Gabrielle.
Thanks, Jenny, and thanks for hosting this important discussion. So two things that I think really stand out are the recommendation for a Global Health Threats Council. This would be the first head of state level type panel to review these issues. And I think having something at that level is incredibly important. It also allows for looking at a whole of government response, not just a health response. As we've seen with COVID, that's absolutely necessary. And then secondly, the financing mechanism for pandemic preparedness is also critical. And I could go on, but I know you wanted a short answer.
We can go deeper later on that. Thank you so much, Gabrielle. Chandrika?
Thank you, Jenny. And at the thank you for having me here. And at the onset, I do want to say that I think this is an excellent report, both in terms of its breadth, but also in terms of the creativity of the recommendations and really going beyond what one would normally expect from a panel of this kind to really thinking through some of the core issues. There are two recommendations that I particularly wanted to make reference to. One was the call for an agile surveillance and a validation and an alert system. And I think this is absolutely critical in the context of a fast-moving and a fast evolving pandemic. And we can discuss later on why I think it's so important, but particularly in the way the information has flowed and affected low and middle income countries, I think this is critical. The second recommendation that also immediately struck a chord was the pre-negotiated platforms for tools and supplies for COVID-19. Again, looking at this from the context of resource-constrained settings, this is absolutely critical in terms of global management. So let me stop here and then we can come back to some of these issues.
I think the World Health Assembly currently is also discussing some of those recommendations. I'll get back to you on that, Chandrika. And Ambrose?
Thank you very much for inviting me to comment about these recommendations of the panel. I think the panel recommendations are really very welcome. And specifically, I look at the one on invest in preparedness now to create a fully functional capacities at the national, regional, and global level. If you look at really just a background, I mean, the COVID-19 pandemic has unraveled the need for robust public health emergency preparedness and response capacities. And this is the only way we are going to save lives. So the panel is really spot on in making this recommendation. COVID has showed us that we have interrupted access capacity of the health system, the ability to deliver services. But COVID has also showed us that it has interrupted the quality capacity. Our health workers are getting infected, and all these are preparedness capacity. And demand capacity has also been affected. So you look at people have lost incomes. And finally, what COVID has done is really it has affected the resilience capacity, where we are able to deliver continuity of services even when we have a shock event. So for me, this first recommendation is really very, very, very critical and is welcome. The other that I really want to introduce briefly is that countries establish high-level national coordination for pandemic preparedness. And this is very key because let's first start off and say building capacity for pandemic preparedness is the primary responsibility of national governments. So we need we need high-level political commitments. We need high-level coordination mechanisms. But also, COVID has showed us that we need multiple stakeholders, multiple disciplines. And the placement of the international health regulations focal point in the Ministry of Health kind of shoots us in the foot. And the recommendation here is really to have a high-level coordination mechanism with gravitas to bring together different sectors, different actors, including the community. So I think that is also a very, very welcome recommendation.
I wanted to touch on those, that coordination mechanism, and as well as, Gabrielle talking about the Global Threats Council. There have been talks about, we already have a very convoluted global health architecture. What gaps are this, structures going to fill? Or are they just going to add on to this already, crowded system? Perhaps, Gabrielle?
I'll start. So I feel very strongly that the answer is in your question, which this isn't just about global health. And so while there is a complex global health governance system, we need to ensure this moves outside the health sector. We've seen in so many countries the devastation of the education sector, of small businesses. And so this really needs to be a higher level than just within the health sector.
Do you have anything to that, Ambrose? Add to that?
Ambrose? Yes, I think so. I really think the to elevate the leadership to prepare and respond to public health emergencies at the global level is critical. We've seen in the COVID-19, member states, I think, have had an issue. That was the issue of compliance with sharing even information and compliance with implementing the temporary recommendation. I think there should be some kind of peer-to-peer mechanism and where we can really bring member states to account. And I think that's really, for me, the Global Health Security Council has a role in trying to improve global governance. And also linked to what Gabriella was saying, I think, and what we'll be addressing later, and this whole notion of focusing on strengthening the capacity of WHO, we need to look at the mechanism of how that is going to be done, and that's so at the global level. But I also have to add that outbreaks, much as we have the global mechanism, outbreaks cannot only be controlled at the global level. So we need governance structures at the country level. In fact, I was listening to a colleague from delegate of Nigeria this morning and was like, we need subnational leadership. We need subnational leadership. And if that is not there, then outbreaks are not detected and we detect them late. So we need, the recommendations are good. We have to have a balance on how we are going to implement them in terms at the governance level, the global and regional level, but also within countries.
How can we take some of these things forward? Right now, a lot of countries, India, for instance, is battling a very, deadly wave of COVID infections. How do you think we can start working on some of these recommendations, as well as some of the things that you mentioned, Chandrika?
I think, this is actually why the two recommendations I mentioned jumped out at me, because part of the challenge in India has been around information and understanding. So, for example, just one example of this is understanding the emergence of new variants and how they actually affect the trajectory and the speed of transmission. This is something that has to be done in real time. It's something that takes resources, and I think one of the challenges that India faced was that we didn't have enough capacity to be able to do sequencing of enough cases in real time when these variants were beginning to circulate. And so by the time we really got a handle on what was happening, it was already too late. And this is where a global surveillance and alert system can really come in handy. Now, there's a tension here, and I want to acknowledge that tension. It's something that I think Gabrielle made reference to a little bit earlier, which is this tension between an organization like the WHO being the sort of gold standard of scientific advice and guidance to member nations on the state of the pandemic and on the cutting edge science that we know about the pandemic, versus the speed with which this information evolves. And the report talks about this very nicely, talking about the fact that the virus transmits faster than the guidelines evolve. And I think this is going to be an ongoing challenge, particularly today, where there is a democratization of scientific, not just scientific work on this, but where scientists have platforms that they probably didn't, let's say, half a century ago. So what that means is, and what we've seen through the pandemic so far, is that the WHO, because of the precautionary principle, has actually been quite cautious about changing its recommendations, and it struggled. You can see the struggle, and that struggle is an understandable one. But I do think that if we are to, if we move forward in a post-COVID world, what an organization of this kind, the kind of role it should play, is really to be proactive and not reactive to science as it's emerging. And we've seen the WHO play more of a reactive role so far, whether you talk about airborne, whether you talk about the advice on international travel or on mask wearing or even designation as a pandemic. It's been a little bit reactive, and that's understandable given the structure of the organization. But I think this is a real tension, and that's why having agility, not just in information gathering, but also being able to very quickly identify where there is evidence coming from, to be able to evaluate that evidence, and then to be able to put it forward, is really important for credibility, and for having that standard where countries will actually trust the information coming out of the organization. So that's where I think the tension lies, and it's hard for an organization of this that's structured this way to be cautious, to actually move at that speed. But I think that would be inevitable, absolutely essential in terms of management.
I want to throw back the question to Ambrose, because it was interesting that Chandrika mentioned about, the variants are kind of transmitting faster than the guidelines are changing. And the independent panel actually made specific emphasis on this whole precautionary approach, right? So Ambrose, I wanted to see, how do you see WHO taking this recommendation forward? What do you see are the opportunity? What can be done for WHO to be able to do that? And what challenges do you see for WHO to move forward with that, to make that happen?
I think we'll start off with the declaration of a public health emergency of international concern. And I think that's where the panel is advising us to take a precautionary approach depending on the cause of the public health emergency of international concern. And I also think the panel is also recommending, both actually the HR review committee and the panel have really recommended the independence of the HR review committees, but when they make those recommendations or declare a public health emergency of international concern, measures are put in place immediately. And as I said earlier, we've seen countries that, the temporary recommendations are voluntary, but we've seen some countries implementing them, but we've seen others not do so. So we might have to have a mechanism where we ensure that the temporary recommendations are reinforced. Now, on the whole notion of how we take on the whole variance of concern, I think it's linked to what my colleague was saying. I think with this, the Center of Intelligence as a hub being set up, I think at the regional level, where this is in Berlin, I think that what this can do is really link up to networks of information centers. So it could be genomic surveillance centers that are being created. And so these are linking up and feeding into this intelligence center. And so WHO has a role working with all the other stakeholders in this space, including the academia and research institutions. But having said that, again, for us to detect outbreaks early, we need institute peripheral health workers who can diagnose these events very, very quickly. So that is also linked to the second recommendation of having these capacities everywhere. And I think the issue is now, and I recall that the revision of the 1995, the 2005 HR International Health Regulations was actually first put at the World Health Assembly in 1995. And it was not until we had SARS in 2003 that it was revised, and then it came into force in 2007, and then no capacities were established, and then they have been extended every time countries say we have not yet fully met the capacities and we extend. I think what the panel is saying this time, and I look at, she has even set timelines, and I think this for me is really very, very welcome, because prior to Ebola in West Africa, post-Ebola in West Africa, we had the National Academy of Sciences that came up with a very nice report as well, the Commission on Global Health Risks Framework for the Future, and made some of the recommendations, but there was no timeline. And I think for me, what is really good this time, and I hope that the actors who have been put in this report will be taken to account if these things are not in place.
I wanted to, ask Gabrielle, because she talked about the, financing facility earlier, and our Chandrika and Ambrose were talking about capacities for genomic sequencing, and there's huge discussions about vaccine production capacity. Gabrielle, this financing facility, and we're talking about billions of dollars here, mobilizing billions of dollars every year. How do you think this should be used and can be made effective to make sure it's actually going to where we need to invest to be able to prepare for the next pandemic?
Yeah, great question. I want to follow up on Dr. Ambrose's comment first, as I was part of a number of the Ebola reports, including the National Academy of Medicine one. And it was very frustrating to see all of the reports get written and produced, and many panels and discussions, and then very little change happens. It's referred to as a cycle of panic and neglect. And so we need to break that cycle this time and ensure that the recommendations of the panel are taken forward. And that was actually a large part of why Pandemic Action Network was created, to ensure that there was political advocacy in between pandemics. So getting back to the panel's report, the recommendations on financing are incredibly important, but we think they're actually quite low compared to what's needed. And you only have to look at what the world has spent on response to COVID pandemic and the devastation to so many small and large businesses across the world to see that investment in preparedness will pay off. And so I don't have the specific answer at the moment on what the first investment should be, but I do think, first of all, we have to end this pandemic. As we see, Chandrika and I were talking prior to the panel, the situation in India has been devastating, and it continues to be devastating in rural India and many other Southeast Asian countries. And so we have a ton to do to end this pandemic. And what we truly need is a global vaccine plan that is globally coordinated, that we're looking at the full set of supplies, that we're vaccinating vulnerable populations, not just in a completely equitable manner, but looking at how we reach healthcare workers, which countries are most at risk, and then we're getting the vaccines to them. Right now, we're relying on too much goodwill, and there's not a coordinated plan.
We have very few minutes.
Okay.
But yes, please, Ambrose, if you can quickly.
Yes, I think this financing facility, for me, probably this is one of the recommendations that, well, I think it is necessary, but I also recall in 2006, the World Bank set up a pandemic emergency financing facility.
Right.
As both an insurance model and a cash model, and countries have actually had challenges accessing funding, especially for preparedness, using the World Bank's pandemic emergency financing facility. So I think this is a recommendation that we might need to go back to the drawing board and say, what has been the failures or the successes of the World Bank pandemic emergency facility, and how can this leverage and be improved? And I look at the panelists. We shouldn't create a new institution. Maybe this should leverage on the Global Fund to fight AIDS, malaria, and TB, because they're already funding the platform, and with the lean sector which is linked, and then move forward. Because that's the issue, that we already have a facility that has had some setbacks in accessing money.
Going back to the drawing board, that's a good one. Chandrika, perhaps you can help wrap up. How do you think this facility can be most effective on the ground, especially given
I
the
want to actually
situation you're
also
seeing in
respond.
India?
Yeah, I also want to respond to what Gabrielle said in terms of the global vaccination plan, and I completely agree with that. But I do think if there is one lesson we have from the pandemic is that the absolute worst time to make these plans is when you're in the middle of the pandemic, right? That's when all of the vaccine nationalism, all of the immediate day-to-day imperatives and crises of the pandemic put pressures on governments. So the time to do this is actually before or after, not during. And I think that's the big lesson even in terms of the financing facility. How do we make sure that the funds, and going back to Dr. Ambrose's sort of concerns around how previous efforts have not worked out, I do think there needs to be a mechanism which is not dependent on the state of pandemic. And that's one point. And the second point is we cannot have a facility that focuses on pandemic preparation when in most low and middle income countries, the healthcare system itself is so weak. So you have to think about pandemic preparedness in the context of financing the health system. And maybe that is a more sustainable way to build resilience in the system so that when shocks of this kind hit, there is greater ability to withstand and cope with it. Not enough, but at least more than what we've seen so far.
But we don't have much time, but thank you so much to our panelists for all of your great insights, talking about the Global Vaccine Action Plan, having to look into what lessons from the past on pandemic facility and when should we be starting to look into some of these things. Thank you so much, everyone. And please stay tuned for our other events today.